Okay, so I'm gonna be performing an ostomy bag change today. So I would have my materials, I have some clean gloves, I have the measuring tool for the ostomy, I have the ostomy adhesive along with the bag, and my biohazard bag. So I'll have gathered my equipment. I've already checked my doctor's orders. I will come in, introduce myself to the patient, and explain to them that I will be changing their bag. And I will perform hand hygiene and place on clean gloves. I'm going to make sure the patient is covered to ensure their privacy. I will unclamp the bag and empty the bag so we don't make a mess. And then I would remove the bag and place it in the biohazard bag. After I place it in the biohazard bag, I'm going to assess the site and make sure it's nice and beefy red, so we don't want any discoloration. We want to make sure the site is receiving circulation. We don't want it dusky or gray or anything like that. So the site is beefy red, so I'm going to clean the area with some soap and water and pat dry. Once I do that, if my gloves are soiled, I'm going to take them off and reapply new gloves. But I'm going to keep these on. I would use my tool to measure the site of the stoma. It should measure completely around the stoma. You should have a little wiggle room, but not too much. So this one is measuring at 1.5 inches. So once I measure that, I would take my adhesive device and I would cut around to 1.5 inches to make sure that the bag secures properly. And then after I do that, I would attach my bag to the device and pull off the adhesive tape and attach it to the patient so it would fit like so. I would make sure the bag is sealed and clamped at the bottom. And then I will remove my gloves after I cover my patient and gather my dirty equipment. I would remove my gloves and perform hand hygiene. And I would document the appearance of the stoma, how the patient tolerated the procedure, that the bag was still intact, and that the patient tolerated the procedure well. And that would be it.